Okay, today we're here with Miss Jamie McCullars.
That's it, McCullars.
Okay, awesome. I'm so glad that you're here. We were talking before we got recorded that you've been one of our top requested people to sit down and visit with. So excited that you had the time to do it. And I want to learn a little bit about your practice. But before we get into that, hometown girl, grew up in West Washita.
Yes, indeed.
So tell me a little bit about your upbringing.
So I grew up just a little country girl, played a lot of softball, and that's really one of the ways that I got introduced to chiropractic. My uncle was a chiropractor, so I was adjusted at a very early age. I was a pediatric patient of his, I think maybe one of his first. He didn't do a whole lot of peds either. But his name was Michael Shell, and he used to own Shell Chiropractic before he passed away. And so that's how I was originally introduced to chiropractic. And so I went to West Washita, and the main reason that I got adjusted as a kid was because I played a lot of softball with West Washita, very active, and, you know, softball girls are always needing work on their shoulders and all that good stuff. So
I got you. So ULM grad?
I graduated from Louisiana Tech.
Okay, Louisiana Tech. So Louisiana Tech. And when you went to college, did you know at that moment that you wanted to pursue this career, or were you still kind of that young, I'm undecided and not real sure?
I think I did. I have this card. It was a card that my best friend gave me for my 16th birthday at the time. And it said that she was going to be a vet, and she's a nurse now, though. But it said that she was going to be a vet and that I was going to crack her pet's bones or something like that, because I'd always said I wanted to be a chiropractor like my uncle.
Okay.
I went through a phase while I was at Tech, and I kind of thought maybe I want to be an OB-GYN or a midwife, because I started kind of getting interested in, you know, women's health and things like that. And then I ultimately decided toward the end of college that I wanted to pursue chiropractic school.
So you graduate from Louisiana Tech, and where does one go to chiropractic school at?
Well, there's not one in Louisiana, so you can't go to Louisiana. Maybe one day, though. The closest one is Parker University. It's in Dallas.
Okay.
And there's another one in Pasadena, Texas.
How long did that school last?
It's almost like medical school, minus the extra work once you become licensed. That's a little bit different, but it's about 4 years after you get your college degree. So altogether, it's about 8 years.
Wow. So you got to be dedicated to the practice.
Very much so. It's a very intensive program.
So you graduate from the program, you move back home. Do you work abroad for a little while, or?
Well, I was in Dallas, where the school is, and I wanted to stay in Dallas really badly. At the time, I wasn't married yet. I was a single girl, and Frisco, Texas, one of the years I was there was like the top-rated place to live and
it's
growing.
Still a nice place, Frisco is.
Yes, it's very, very nice. And so I fell in love with Frisco, and I had my heart set on Frisco. And then I decided that I was going to come back here with my parents. And, you know, I was a little bit miserable after I made that decision, but it was really the most financial savvy decision at the time for me. And I'm glad that I did, because once I got here, then I realized, you know what, I prayed really hard about it. You know, God wants me to be in Northeast Louisiana because there's no one here to do what I'm doing, to kind of help pioneer and help educate our community about chiropractic and, you know, better health for our families.
So did you initially start out with your own practice, or did you work for another chiropractor locally?
I worked for a couple of other chiropractors, and I definitely learned a lot. I started to try to open my own practice. I had a little bitty building in Ruston that I rented out for like $300 a month. And then I realized I don't have the motivation to do this, at least not yet. I can't do this. I don't have any patience. I don't know what to do. That's one thing when you go to professional school in healthcare, they don't teach you anything about business. And owning your own business, no matter what kind of a doctor you are, you're still a business owner. Yeah. And that was a big deal for me, that I didn't know how to do any of that. So
it's a big commitment, isn't it?
It's very big. And that's why I just tucked my tail and came running. My first big girl job was with Dr. Dallas Humble at the Joint, and so I was a clinic director there for 4.5 years with him, and I learned so much from him because he is a really savvy businessman. So kudos to him. He's done a lot in his lifetime already in the business world and in the chiropractic profession. And then after I worked for him for a little while, I worked for Dr. Dan Steffens with Spinal Health Center. And what I learned from him was less business, even though he was a business owner. I learned so many business things from Dr. Dallas, but I learned a lot of clinical skills and gained a lot of clinical confidence with Dr. Dan working for him. So there's a reason why I got to work for both of them.
Sure.
So
at some point through that process, you're like, I'm going to try this. I'm going to do it.
Yeah.
So how long have you been with your current business?
So I got pregnant with my second son in 2017, and I was working for Dr. Dan Steffens at the time. And I took maternity leave after I had the baby, and then I came back and was working for Dr. Dan again, and I was missing my baby at home. And my husband actually lost his job. Well, first he said, sorry, let me back up. I'm getting ahead of myself. My husband said, okay, I got this new job, and I want you to be a stay-at-home mom. So I said, well, I'm not going to turn that down while my baby's this little. And so I did tell Dr. Dan I'm just going to be a stay-at-home mom. And that's what I did for about 2 months. And then the new job that my husband got didn't work out, and he was let go. And we were devastated. So I said, I'm going to either have to go groveling back to him or, to any other chiropractor around town who will take me, or I'm just going to have to do something on my own. And at that point, I just kind of jumped off a cliff, and I said, I want to work part-time anyway, so I'm just going to see what I can do. And my in-laws at the time, they owned Chicken Express.
Yeah.
And behind the restaurant, there was this little garage/storage unit thing. And so in there, it was like a one-room area that was already built out and had a bathroom. So I decided that I was going to rent from them. They let me pay them $100 a month, and it included electricity, water, and internet.
I think you got the best end of that deal.
I really did. And so I was, maybe only seeing 2 or 3 clients a day at the time. And so I was just kind of in and out, and my husband was also looking for another job at that time. So we had a lot of time with our kids, but things were hard just financially for us for a little while. And I just stuck with it, though. Kept seeing people, didn't do any kind of advertising. People were just helping me word of mouth wise. And by the time I was in that spot behind Chicken Express, the one-room show that I called it was like a closet, about 9 months in, I was busy enough to where we started looking for a real place to rent, as we called it. And that was, 2018 was whenever I first opened up in the one-room show.
And the name of your business is?
And the name of it is Bayou Belle Wellness.
Okay, Bayou Belle Wellness. Now, going through that process when you said, I just got to jump back in and I'm going to try to do it on my own, what was different this time than the last time?
Well, at this time I had 2 kids, and I was married, and I guess I was just a little more mature. I had learned, once again, from Dallas, I had learned a lot of business things. And I thought, really, out of just motivation to put food on the table for my family was the original motivation. And then when I started to gain some traction, then I was like, I can actually do this.
When you stepped out that first time, did you kind of have that safety net in the back of your mind that I know I can go back to this place?
Absolutely.
Do you feel because you did not have that safety net in your mind that you felt like the only way forward is through?
Absolutely. My office manager now, she jokes around, but this is very true about me. I work really well under pressure, And if I don't have pressure on me, I tend to procrastinate. So the way that she gets me to move fast in the clinic is that she just packs me. She packs me full, and
Right.
I do really well in my groove. So I work really well under pressure, and I think that had a lot to do with it as well. The fact that I had all that pressure on me the second time around, that failure's not an option. So
What'd you learn about yourself going through that process?
that I'm stronger than I thought that I was. I grew up a very shy person. I read a lot. I was a big reader, so I always had my nose in a book. I never really spoke up about things that I was passionate about. I just would kind of sit there and let other people talk just because I was kind of nervous. But I definitely learned that I have important things that people want to hear, especially now that I'm a chiropractor and really want such great things for this community.
How have you been able to change your voice towards advocacy for your profession and for other women? Because it sounds to me like we were this, or not we, you were a more reserved person than what you are today. And I think a lot of it was you going through that process, from what I'm hearing, process saying that I don't have a plan B. My only plan B is my plan A, and I'm going to figure this out for not just for me, but for my family. And through that growth, have you felt like there's some type of obligation that you have to be able to share your knowledge more with others in a little bit more of a direct way?
Yeah, absolutely. I just feel like, as a young person, I would see people, teachers, mentors, and things like that really impacted me, and I would just wonder how'd they gain this confidence. And it really just is something I feel like that comes with time for some people, and it definitely came to me, but it took a lot of time and a lot of blood, sweat, and tears and experiences to help me get there.
Now, with reading a little bit of your bio before this, so in the field of chiropractic field, I've never really heard of, at least locally, where, this person specializes in this person. It's like kind of always felt like it's just all is the same. It's just a general field, but it sounds like you have really started trying to specialize in certain areas. Am I misreading that, or is that?
No, not at all. When you think of medical doctors, you think there's general practitioners.
Right.
And then there's also other professionals within that sub-professions, I guess you could call them. If you need to see a urologist, you see a urologist. If you need to see a cardiologist, you see a cardiologist. So within chiropractic, there are also different specialties, if you will. Some practices, and this goes for people in this town right now, some practices are mostly personal injury, which is probably what most people in general are familiar with chiropractic about is, I got in a car wreck. I need to go to the chiropractor. But we're not all, that's not what we all do. If you just got in a car wreck, you probably don't want to come to me. I don't have certain kinds of equipment and analysis and things like that a personal injury chiropractor would have, for example.
So what is your area of focus, and what have you been drawn within your practice to really bring to our community to the next level?
So as a mom now of 3, and at the time when I opened my practice, I was a mom of 2 when I went out on my own, a mom of 1 when I started, working for Dr. Dallas. As a mom, I was searching for some kind of sense of community and other people who were looking for healthier ways to live. And coming from Dallas is much more progressive than West Monroe.
Sure.
But West Monroe, the Twin Cities, we've come a long way over
really
the past
have.
10, 15 years since I've been back. And I'm so, so happy to see that. We really want to, at Bayou Wellness, we really want to provide a place for moms. Because if you think about, in most families, who runs the household, as far as making sure everybody went to their doctor appointments, you know, making sure everybody's schedules are lined up with ball practice and all that. That's the mom. And moms tend to put themselves on the back burner, don't take care of themselves. And so they are just always looking for ways to improve the health of their kids. And what we wanted to do is not only provide the care for the children, but also provide the care for the moms as well. And that doesn't mean dads are excluded. I have lots of dads that come and see me too. But we definitely wanted to create a family atmosphere for chiropractic. A lot of times when I worked at my previous jobs, you know, because it was like a very clinical atmosphere, we had rules about, you know, bringing kids and that you had to have someone watch your children. And, you know, we do still have those rules at my clinic because we can't just have it be a complete zoo. Sure. You know, if you are getting some kind of therapy that's going to take longer than just an adjustment, if you're a mom, you can't just bring all 3 of your kids without having somebody come. But for the most part, you know, moms are coming in for wellness adjustments. And they're able to bring their kids and feel safe and comfortable to bring their kids there and not say, well, I guess I can't go to my chiropractor because I've got the kids today.
Right.
So
what are some of the things that, and specifically on the pediatric side, what are some areas that you can benefit moms and their small kids that we wouldn't normally think about?
So there's tons of things that children can receive chiropractic care for. And, you know, most people don't know this, but we can help with chronic ear infection problems, chronic sinus infection problems, just sinuses in general. That's one of the big ones that I see is sinuses and ears. Another one is constipation. I know it's something that a lot of people don't like to talk about.
Sure.
But a lot of children, especially nowadays, because as we were talking earlier, you know, the quality of our foods now with all the artificial dyes and preservatives and just synthetic stuff that's in our foods that the FDA says is okay to eat, but it may not be. Our bodies, our children's bodies, are under a lot more stress and strain than they were generations ago because of the quality of food. And so kids nowadays can, you know, really, really struggle with constipation. One of the things chiropractic can help with is constipation.
I never would have thought that.
Yeah, so these are somatic things that don't ring a bell. You know, when you think chiropractic, even if I were to just ask you and you don't know anything about pediatric chiropractic, what do you think a kid would go to the chiropractor for? You might say, well, if they fell off the playground and you know, hurt their arm or their ankle or hit their back. Those are definitely things that I see too.
Walk me through. So I've got 7-year-old that has ear infections all the time.
Okay.
So what area, how do you treat someone or a kid, or how do you know if a kid is treatable for ear infection through the practices that you use?
So what we are doing is, you know, this is definitely a disclaimer out there because I'm not a medical doctor.
Yeah, and I want to just be clear, the things we talk about today, it's not going to be applicable for everybody. We're not here so we can self-diagnose based off this.
Yes,
If they have questions, they need to come in, get a consultation from you.
Yes, come see me, absolutely.
Look at them. So now that's out of the way. What are some of the common things that you look for, or the areas you like to treat when it's referencing sinuses or ear infection, things of that nature?
Yeah. So, you know, a medical doctor is going to treat the ear infection with usually antibiotics, steroid drops, things like that are going to help that to go away. So I'm not per se treating that ear infection. What I'm doing is I am delivering an adjustment to the upper cervical spine of the child. There's different ways to do it. There's different techniques. You know, a pediatric patient is not just a small adult. So we're not going to just be yanking their neck around the way that some people might think that or have been done at a chiropractor with their own neck. It's definitely going to look a little bit different depending on what age. There's several different ways to adjust infants versus toddlers versus older kids. And so what we're doing is adjusting the upper cervical spine and helping the nerves that come out there to function better in the neck and head area. It's going to help promote drainage. because when a child gets an ear infection, it's really a little harder to clear than an adult, because most children, especially ages 0 to 2, some kids up to age even 9, when we're born, our eustachian tubes are more horizontally oriented, and stagnant fluid, if it gets drained back in there from the sinuses, just sits, and it's more prone to get infected and stay infected after that first infection. And then we see the child that's just got chronic ear infections, and the mom doesn't know what to do about it, and they're so frustrated. And then after the third round of antibiotics, then the nurse practitioner and the doctors are saying, oh, well, that's number 3, so now you got to get tubes.
Right.
And there's definitely a time and a place for those things,
Sure.
because we don't want babies to have ruptured eardrums. I'm definitely not saying that those are not necessary things. For some children, they are. But for some children, it is possible, if you try chiropractic, that we are able to do the cervical adjustments, and it's able to help those tubes drain, because they don't become more vertically oriented until after age 2, up to age 9 is when they, depends on the child really and their anatomy.
And I don't know what you charge, but I would have to assume your way is a lot cheaper than surgery if it's successful.
Yeah, I mean, unless you have like a $0 copay or a super cheap deductible for the surgery procedure, yes,
Yeah.
I can't beat that. But, it's definitely less traumatic on the child.
Sure.
And overall, if you're not including what the person may or may not pay for insurance, definitely cheaper.
What is some of so we talked about the ears and the sinus. What are some other common areas that are people wouldn't ordinarily think that a child could be treated for that you can help with?
So if we're talking about infants, infants can be very colicky. Which also kind of goes into the whole gut, like I was saying, constipation. New
Affects their
babies,
sleep.
yes. New babies have a lot of reflux issues just because that little flap at the top of their stomach is just not all the way matured. None of their gut system is completely matured yet. And so colicky, fussy babies that are having trouble sleeping, we can definitely help with that. Because what the chiropractic adjustment is doing, not just for that infant, but for everybody, no matter what age you are, is it's balancing the nervous system. And whenever we balance that nervous system out, if it is overstimulated for whatever reason, a traumatic birth or whatever we're talking about, balancing that system by aligning the spine is what's going to help that baby to calm down and to sleep better. That baby's going to be more in parasympathetic mode versus sympathetic mode. Sympathetic mode is that fight or flight mode that we all get with that adrenaline, and that can cause us to be in, a state of stress. If that baby is in a state of stress, they had a traumatic birth, they're overstimulated, they had a gazillion vaccines, their nervous system has just been so bombarded with everything in the environment, and they're so young.
Yeah.
And that's what chiropractic is going to help with, is to help balance it out.
So we think about the spine, we think about the cricks in our neck when we wake up wrong, but I recently had a situation with my neck to where I had pain just running down my arm and didn't think it was my neck. I thought I had a problem with my shoulder, to the point to where if you just touched the hair on my arm, I mean, just that whole pain would come down, and come to find out it was, I needed an adjustment to be able to clear that nerve path so it was not agitated anymore. Yeah. Let's talk about pregnant women.
Okay.
You have techniques to be able to work with them. So talk a little bit about that.
Yeah, so I do what's called the Webster technique. I was certified in 2014 for that with a lady named Jeannie Ohm, and she used to run what's called the ICPA, which is the International Chiropractic Pediatric Association. She was such a wonderful lady. I'm so glad that before she passed away, I was able to take that seminar under her. And what that technique does is it's an analysis of the bone called the sacrum, which is that big triangle bone in the middle of the back of your pelvis, so at the base of the spine. And if that bone is shifted out of alignment, it's going to affect the woman's pelvis, and it's going to affect the baby inside of the woman's pelvis. The uterus is suspended in the abdomen by what's called the round ligaments, and they're like two cables. And the posterior or the back side of those ligaments anchors onto the sacrum. And so if that sacrum is shifted, then it can cause the uterus, which is supposed to be a certain shape for baby to grow in it so baby can get in the correct position. It can kind of torque that uterus, and then the uterus gets torqued, and then the baby is not able to get into that optimal position for a good vertex natural birth. And so then we end up with a breech baby or just some kind of a malpositioned baby and a really traumatic birth, whether it ends up in an emergency C-section or just a really traumatic, birth. And so to help prevent things like that, that is why we see pregnant women, is to keep that pelvis aligned. And we do that Webster technique, which is very beneficial for the mom.
So would you say that this is a program you offer that it would be wise for a pregnant woman to start early with you, and it's just a process that y'all go through, or is it a symptom will arise and they need to come based on that symptom?
So what I tell my pregnant mamas is if you are having symptoms, you already should have been in here, but if you didn't know about chiropractic, then, what are you going to do?
Sure.
So that's where I'm here to meet you where you're at. But if you're having symptoms, those symptoms are probably there from something that happened years before you even got pregnant, maybe. There's no way to tell for sure, but, or it could have happened something where I bent over to pick up a laundry basket and then, I caught my back. Either way, if you're having symptoms, you definitely need to be getting adjusted. If you don't have symptoms, it's okay. It doesn't mean that you don't need to get adjusted as well. What we're doing is I call it, nip it in the bud when it's a pebble before it even becomes a boulder. So before you even feel that pain come on, I'm going to be there to check that sacrum and to check your whole spine and pelvis and just to make sure that things are aligned so that as the baby grows, as your body changes over those 9 months, that, we're able to keep things aligned so that you can have that optimal chance at just a really good birth, a really good delivery, a nice, happy, healthy baby and mom.
I think you touched on at the very beginning that we're more progressive today, or I don't know if progressive would be the right word for me to use. I think we're more accepting of your practice from a chiropractic standpoint than we were even 10 years ago.
Yeah.
People really are starting to see the benefit. Without, analyzing somebody, what are some of the common things? We talked before we started recording that we are just an over-medicated society today.
Yes, we are.
In lots of different areas. What are some of the common areas that you see that a person could benefit through the service that you offer without having to maybe have a surgery, something invasive, or be on medication for? What are some of the generalized areas that you could bring relief to someone?
So I was just talking about this with a patient the other day because she wants to go more natural and her husband is all about surgeries, and she was kind of laughing about, their dynamic as a married couple. But first of all, I did want to say you don't have to be in pain to go to the chiropractor. That's one of the most important reasons to go that the least amount of people go for is for wellness and maintenance and preventative care. But if you are to the point of having any kind of symptoms, then you definitely need to be going because, like I said, those symptoms that are showing up now, they may have been there, something that was dysfunctioning in your body in a very subtle way, but for years or decades even.
Sure.
And one of the things that chiropractic can help with is to decrease people's dependency on medications. That's talking over-the-counter, Tylenol, ibuprofen, or even like the more dangerous prescription drugs. Most people, I feel like, would say, yes, I would love to not have to take all that medicine if I had a choice. And so that's what chiropractic can help with, is to help people who maybe struggle with chronic pain and don't want to have to take those kinds of medications, so that they can live their life and do what they got to do, have grandbabies and pick them up, or go, run a half marathon and not be in a whole lot of pain. That's what chiropractic is there for.
Do you see situations where people will come to you and you're like, this is a little too advanced and you really do need to see a surgeon, or you need to be able to see a specialist to get this taken care of? there's nothing I'm going to be able to do that's going to resolve the problem. Does that ever happen?
It does. So I would say rarely. In most cases, I'm able to at least get that person some amount of relief. So coming is still better than not coming at all.
Right.
There are a few situations where, if someone's got a really hot low back and a bulging disc and they've got a lot of, sciatic pain going down that leg, we can definitely take them through a treatment plan and see where we can get. And I almost certainly can guarantee you that they're going to get at least some better. But I co-manage with medical doctors and surgeons all the time and physical therapists as well. I
was going to ask about that.
Like
How
to
do
co-manage.
you guys work together with, PT versus what you do? Is there a plan that incorporates multiple aspects?
Absolutely. If there is something that arises with any patient that I have where I feel like they need to go see a physical therapist or an orthopedic doctor or any, kind of other professional for that matter. With babies, it's a lot of times me sending them to an OT over tongue tie issues. That's another thing I didn't mention. See, it just gets better and better. Babies, with tongue ties. So, yes, I prefer to try to call and speak. If it's a physical therapist, I'm able to kind of leave a message and get them on the phone more promptly than like a surgeon or something. But if I'm not able to speak with that person to co-manage over the phone, then I at least try to write them a letter and explain what I've been doing and how I'd like to continue co-managing, until, something changes.
When you talk about the wellness and then the maintenance type plans, what would that look like for someone? Let's just say my wife says, you know what, I'd like to try this wellness plan. What would that look like for someone?
So if somebody comes as a new patient and they have symptoms of any sort, I've got this numbness down my arm or my back hurts, I will definitely take them through a care plan. And as we go through that care plan, as we are aligning the spine throughout that care plan, the goal towards the end of that care plan is for me to be asking them, like, okay, how are you doing today? And them to tell me, I feel great today. I haven't had any pain. I haven't had any numbness, whatever that symptom is, it's gone. And that's when I say, okay, we want to keep it that way. And then we want to discuss our options about a good maintenance point for that person.
Okay.
So maintenance care is coming in periodically. It's different for every person. It's coming in periodically just to get their spine and pelvis checked and to get them aligned. And then, a lot of people at this point think, oh, well, I feel so much better. I'll see you again when I hurt.
Right.
And that mindset, there's nothing wrong with telling me like, okay, I'll come back when I'm hurting. I will still absolutely see you again and help you feel better. It's not that I want to discourage people from doing that.
But you could have possibly prevented.
But we can prevent it if you keep coming. And so it's kind of an old wives' tale that, well, I've heard if you go to the chiropractor, you have to keep going. But it's not that you have to keep going. I'm not forcing your arm here. You can choose to continue coming, and those adjustments are going to build on each other over time. And you're going to see so many benefits, GI benefits, immune system benefits, just so many things whenever your body is functioning optimally because things are lined up and your brain's communicating through those nerves that there's not any interference on to those body parts.
So is that what you're saying really causes the problem, is that when there's interference with that nerve back to the brain, things just don't operate like they should?
Absolutely. Our body is a self-regulating, self-healing organism. So if you get a scrape on your knee, for example, and that scrape, you don't have to sit there and tell it every 5 minutes, all right, keep healing, keep healing. Eventually, after a few minutes, the blood's going to clot. And you're going to forget about it after the pain goes away, after a day maybe, depending on how bad the scrape is. But then a few days later, you may look down and see a scab. And a few days after that, you might look down and the scab fell off and you didn't even know it. And you never had to tell that knee to heal. Your brain communicates with all of your body parts in that way. And that's what those feedback loops are. That's what your nervous system is there for. Your nervous system basically senses the world around you, and it helps your body to adapt to whatever your environment is. So whether that environment is, oh my gosh, it's cold weather, I feel cold. Or I just skinned my knee, I feel pain. Or, I just ate an apple, I'm going to digest it. Your body is doing all those things all right now. We're probably digesting I don't know if you ate lunch yet, but I did. I'm digesting my lunch right now. And I'm still able to talk to you. Right. So my body, all those autonomic functions are going on. So chiropractic is going to help align the spine and other joints so that those nerves have a clear path to travel and communicate that feedback. The brain senses what's going on with the body, and then the brain tells the body to do certain things.
Great way of explaining that. What are some of the pain points that you hear from people, or the myths about what you do that we need to correct in people's minds?
Well, I feel like the biggest one is just that you have to be in pain to go to a chiropractor. And that's definitely not true. I have so many patients who come every single week to get adjusted. I have families that bring their kids, all of them, every single week to get adjusted. And some people may think, oh my gosh, might be so expensive. We do have membership plans where you save a lot of money. For every family member you add, the price keeps just going down. So it's an affordable way to do it if you have a practice like that with wellness in mind, so that you can make it convenient and affordable for people to be able to attain that care.
The key of having a plan, and if you're thinking about my wellness today, tomorrow, and in the future, having some consistency is going to obviously drop the price, I would think. And the more family members you have, the cheaper overall it's going to be. What are some of the common things that you see that you could help the average person with on a daily basis if they would just say, hey, I need to take better care of myself and get on a maintenance plan? What are some of the common things you think that the average person deals with? And I'm sure age specific is going to matter, but what are some of the common things that people could take some benefit immediately from?
Yeah, so, earlier I was talking about infants with, the colic, reflux, sleeping. Those things for infants would be the big ones. Toddlers, babies learning how to crawl as you kind of move into that age group. If they have an asymmetric crawl or an asymmetric walk, those are things. We need to look at the hips and pelvis, or even up into the thoracic spine, their mid-back. I had a baby one time. He was a toddler, not a baby, but he had fallen off of a bunk bed, and his mom didn't see how he fell, but we kind of figured that maybe at the time we didn't know, but he had fallen like flat on his back, we guessed. And he was limping with one of his legs. He just couldn't put pressure on that leg. He was just crying for days. She took him to the ER. They did all these x-rays of that baby's leg and hip, and they were like, there's nothing wrong with him. She took him to the pediatrician. They were like, I don't know. There's nothing wrong with your baby. And she's like, something is wrong with my baby. He was fine before, and he will not bear weight on his leg. And so she brought him to me after the first visit. It wasn't his leg at all. It was up in his mid-back. He had fallen and hit there, and it had those muscles contracted all the way down on one side, down into the hip and pelvis. And that's why it was putting pressure there, and it was causing him pain to bear weight there. So bumps and falls and things like that for little kids, those are big ones. We don't always see what happens to them. Right. We just know they come to us crying after the fact. So getting your kids, adjusted on a regular basis, there's no telling what they did that we don't even know that they did. So just having someone to be able to check their spine periodically, because as their spine is growing, as the twig is bent, so grows the tree,
Sure.
And the first couple of years of life are, a time whenever your body changes more dramatically than any other time, besides maybe puberty for boys, because they shoot up pretty quickly too then. And that's an important time for boys to get adjusted, is during puberty, just because they're going through puberty. Right. Kids just in general, falling out of treehouse, falling off their bikes. For older kids, it would be more like sports injuries, repetitive or like a traumatic, thing. If somebody just got hit real hard and got knocked down in football versus a pitcher that just has a lot of overuse of the shoulder, and maybe their shoulder is a little bit out of alignment and their upper back is a little bit out of alignment, and then it's causing them to very subtly improperly use that shoulder. It's dysfunctioning, and then you have a rotator cuff injury, and child is out.
What part do the muscles play in affecting how the spine maneuvers and operates? Does that have really any impact on when you're? I've always just assumed when you hear chiropractic, you're cracking the neck, popping the spine. But do the connective tissues play a big role in how that all works?
100%. I was at a seminar back in August, and we were all talking about that, about how, the muscles anchor in and they braid in and braid against the bones and then braid into another group of muscles, and they all tie in together to help your body create a certain movement of your shoulder or of your hip or whatever body part we're talking about. And so those muscles are a big deal too. And the brain also communicates with those muscles, just like it communicates with your organs and with your joints as you're trying to move. And so the muscles are a big deal too. So we definitely don't want to not address those. The most important thing for a chiropractor is to make sure that the joints are aligned, of course, but also to not forget about those muscles as well.
Reading your bio, it sounds to me like community is really important to you. And when I say community, I know Northeast Louisiana is our community, but it's the moms, it's the families, it's the support network that you have with. You mentioned that there's some doulas that you work with. Tell me a little bit about that community and what it means to you.
As a mom, I have been looking for community and connection with other like-minded families, and that's what we want to provide. We're not just a chiropractic clinic. That is the primary service we provide, but we want it to feel like a mom is coming with her family, like she's coming over to a friend's house for coffee. Although we don't have coffee there right now, but we do serve hot tea right now. So you really could get tea if you come. But no, in all reality, we want the moms and the families. We want dads to come too. There are plenty of dads. I know I'm a small person compared to some of the men that I adjust. Some of the men that I adjust are pretty big guys.
Yeah, but I felt your handshake coming in. I commented on that. So you got some muscles behind that small frame of yours.
Yeah, I was nicknamed by a patient. It was a man, go figure, mean thumbs years back. And so, yeah, I do bring the mean thumbs when I need to. But, if it is just a really big guy and I do feel like I can't get the proper movement, I rely a lot on my speed and my technique so that I don't have to be strong to be able to do it. Because like I said, I do still have plenty of big dudes that come see me and they love me. But if I really do feel like it's just not a great fit because I am small and they just need a little more pressure, a little more power, I definitely am happy to send them to a dad chiropractor, that can get them feeling just as good as I get those moms feeling. So
where do you see your practice going? Is there anything that we should be looking for in the future, or you're just going to kind of be organic and see how it grows?
I just want to see how it grows. I definitely would like to continue making an impact in the community and just getting the message out there. A lot of people just don't even know that children can get adjusted, or they immediately say, "Oh, I would never," but they really don't even know what it looks like to see a child get adjusted. We've put up some reels of me adjusting infants, and it's very gentle. Even then, we still get haters on the Instagram that comment and say like, "Oh, I would never." But it's very, very gentle for the babies, and even for the adults. I have a lot of adults that come to me who might have not loved chiropractic in the past for whatever reason, and there's definitely a more gentle way to do it for some people. Some people don't love the pop, and that's what I tell them is that there's more than one way to skin a cat.
Sure,
you don't have to get it all popped. But if you want that too, we can use that technique and make you feel great with that too. So,
Well, I'm just excited to know that we have someone in our community that not only loves what they do, stepped out of her shell to start something and make it her own, but has a care and compassion for the kids to bring something or to give parents an option outside of the normal. Let's just give them some melatonin to go to bed, or
Right.
let's go back to the doctor again and talk about some tubes and remove an adenoid, whatever the case may be. That moms now have more options, and that you can tell in talking to you that you love what you do, and our community needs a lot more people like you in it.
Well,
And
thank you.
I think it's also inspiring for. I'm really, I'm an entrepreneur myself, and even though we're on the real estate side of things, I love seeing people take their passion and make it their own, and be willing to step out and do it. And I can tell you through interviewing several entrepreneurs in my time that the people who succeed are the people that don't have a plan B, and that are willing to fight the fight, to do what it takes to make your plan A your plan A. So
Yeah, absolutely.
kudos to you for doing that.
Yeah.
The success of your business, we've watched it grow, and there's no doubt in my mind it's going to continue to grow. If we can do anything to support you down the road, just count us in. We're in with you on that.
Yeah.
But thank you for what you do for our community.
Absolutely.
And
I
if
love it.
moms want to reach out to you to learn more about it, where can they go to find out more about?
So we're located in downtown West Monroe. I think I left off as far as my story where I moved out of the one-room show, and I moved almost right across from the post office, and I was there for almost 2 years renting out, and then a small space came available right next to Forest Temple, and we bought it. It was very dilapidated, and we remodeled it. And, I looked at it and I said, I want to make this something beautiful. And it was just such an eyesore. You walk past these other open businesses and then you see this vacant spot with just
Right.
holes in the wall. And so we took it, and we took a crazy idea and ran with it. And, I'm so happy to be located in downtown West Monroe.
Has it
thriving.
not really flourished over the
Yes.
past several years?
I love our downtown vibes. So if we ever grow out of that place, which we're well on our way, I would hate to leave downtown West Monroe. I would love it if I could eventually find a spot maybe bigger than what we have now, but somewhere that's also in downtown West Monroe. So we're at 317 Wood Street.
Okay.
We're right next door to Meraki and Forest Temple. And we have a website. It's www.bayou.bellewell.com. And Belle is spelled like the Disney princess. That's always
Okay.
what I tell people. It has the E at the end of it. And so they can go check out our website, and they can call it. They can give us a call. We call it the Well line. It's 318-789-2302. And people can call or text that any time of day. It is not like my personal cell phone or anything. So if at 2 a.m. they decide I want to text them and book an appointment, that's fine. And we also, if you go to our website or to our Facebook page, Bayou Wellness, we should have a link there for you to get onto our booking site. And you can
awesome.
also online book. And so a lot of our patients just love the convenience of being able to online book. That way they don't even have to stop at the front desk except to chat if they want to. And
I can tell you online booking is like the way to go, because
Yeah.
I never think about booking stuff till like 9 o'clock at night.
yeah, when most office hours are closed. Me too.
So I love that. Well, look, thanks for coming in, giving us your time. I know it's valuable.
Yes, sir, absolutely.
I think you're doing something great for our community, and I just can't wait to see how you grow from here.
Thank you so much. Thank you for having me, Brian.
All right. Thank you for taking the time to watch or listen to this podcast. We really appreciate your involvement. Please leave us a comment, or even better yet, subscribe to this podcast and hit that notification bell so that you can be alerted for every new episode when it hits.